Let's talk about an organ that most of us, well, we never really think about it unless it's causing some serious, serious pain. I'm talking about the appendix. It's got this reputation for being a totally useless evolutionary leftover, but you'll see that its role in the world of surgery is anything but insignificant. So, let me just start with a question for you. What if I told you that this supposedly pointless little organ was actually the #1 reason people get rushed into emergency abdominal surgery? Because, well, that's exactly the situation. Acute appendicitis, which is just a fancy term for an inflamed appendix, is the most common cause of what doctors call an acute abdomen. That's any sudden severe belly pain that needs a doctor, like, right now. And for a lot of surgeons, an appendectomy is one of the first major operations they ever get to do. So yeah, it's a pretty big deal. Okay, so to really get why this tiny organ causes so much chaos, we've got to understand what it actually is. And it turns out the appendix is a little bit of a medical puzzle. Its full name is the vermiform appendix, which literally means worm-like appendage. It's basically the small muscular tube that's attached to the large intestine and just sort of ends. And here's a fun fact for you. You only find this organ in humans, a few types of apes, and get this, the wombat. Yep, that's right, the wombat. Now, here's where it gets interesting. The appendix doesn't just sit in one spot. In about 3/4 of people, it's tucked behind the large intestine. That's called the retrocecal position. But for everybody else, it might be dangling down into the pelvis or in a couple of other spots. And this little detail, this variability, is a massive clue as to why diagnosing appendicitis can be so incredibly tricky. We'll definitely come back to that. And that whole idea of it being useless, well, science is starting to think otherwise. The appendix is actually loaded with immune tissue, which suggests it's part of our immune system. It might also be a safe house for all the good bacteria in our gut. And believe it or not, people who've had their appendix out seem to be less likely to develop ulcerative colitis. So it's not so useless after all, is it? So if it has all these cool, helpful functions, why in the world does it so often turn into a 5-alarm surgical emergency? Let's get into the anatomy of how appendicitis actually happens. First, let's talk numbers. How common is this? Well, the lifetime risk of needing your appendix out is about 8.6% for men and 6.7% for women. Now, just think about that for a second. That's roughly 1 in every 12 guys and 1 in every 15 women who will have this surgery. It is an incredibly common emergency. Okay, so how do we go from a perfectly fine organ to a ticking time bomb? It all starts with a blockage. Something, usually a tiny hard piece of stool, gets stuck and plugs up the tube. Then, mucus starts to build up behind it, and the pressure just keeps rising. This pressure gets so high, it actually squeezes the blood vessels shut, cutting off the blood supply. And when the appendix wall is starved of blood and oxygen, it gets weak. That's when bacteria can punch right through it. The last and most dangerous step is perforation. The appendix literally bursts open, spilling all that infection into your abdomen. Now, some things can make this whole dangerous process happen even faster. It's a bigger risk for the very young and the very old, and for people with weaker immune systems or diabetes. And remember that blockage we talked about? That's a major risk factor. Same goes for having an appendix that's positioned down in the pelvis, where it's just harder for the body to contain the inflammation. Since a perforated appendix is so dangerous, figuring out what's going on and fast is absolutely critical. But like we hinted at before, it is not always a simple diagnosis. It's really more like a piece of clinical detective work. The classic clue, the one you always hear about, is how the pain behaves. It usually starts as this vague, dull ache right around your belly button. But then, over a few hours, it moves. It migrates down to the lower right side of your belly and turns into a sharp, constant pain in one specific spot. That shifting pain is the absolute hallmark sign doctors are looking for. And this is not a new discovery. Way back in 1889, a surgeon named Charles McBurney was able to describe the exact spot of maximum tenderness. We now call it McBurney's point, and doctors today still press on that very same spot during an exam. To help with the detective work, clinicians use tools like the Alvarado score. It's a system that gives points for different clues. You get points for that migratory pain we talked about, for loss of appetite, for nausea. You get more points for tenderness when the doctor examines you. And then they look at your blood work for signs of infection, like a high white blood cell count. If you score a 7 or higher,
Well, it's very, very likely you've got appendicitis.
And this is where it all comes together. Remember how we said the appendix can be in different places? This is where that really messes with the diagnosis. If your appendix is tucked behind your intestine, you might not feel that classic tenderness on your belly at all. The pain might be more in your back. And if it's down in your pelvis, it could be irritating your bladder or your rectum, making you feel like you have to pee all the time or giving you diarrhea. The signs can be completely different, which is why a really good physical exam is so important. So, once all the detective work is done and the verdict is appendicitis, the next step is to solve the problem, and that almost always means one thing: surgery. The operation is called an appendectomy. The old school way was to make one larger cut. But today, the go-to method is laparoscopic, or keyhole surgery. The surgeon makes just a few tiny little holes and uses a camera and special long instruments to do the job. This means less pain, a way lower risk of infection, and a much, much faster recovery for the patient. But hold on, is surgery always the immediate answer? Not quite. In some very early, uncomplicated cases, a strong course of antibiotics might be enough to clear up the infection. And sometimes, the body does an amazing job of walling off the inflammation all by itself, forming what's called an appendix mass. When that happens, it's often safer to treat with antibiotics first, let everything cool down, and then think about surgery later on. But the story doesn't just end with a simple case of inflammation. No, the appendix has one more secret up its sleeve, and it's a final twist that can be pretty shocking. It's rare, but the appendix can actually develop its own tumors. We're talking less than one person in 100,000 each year. And the wildest part? Most of the time, nobody has a clue they're there. They're usually found by surprise, by a pathologist who's examining an appendix that was taken out for what everyone thought was just regular old appendicitis. These tumors usually come in two main flavors. You've got neuroendocrine tumors, which grow from hormone-making cells and often pop up at the very tip of the appendix. And then you have epithelial tumors, which grow from the lining and are known for producing huge amounts of a jelly-like gunk called mucin. And if one of those jelly-producing tumors bursts, it can spread those cells all over the inside of the abdomen. This leads to a very rare but very serious condition called pseudomyxoma peritoniae, or PMP. What happens is the belly just slowly fills up with this gelatinous goo, causing all kinds of problems. This just goes to show you how this harmless-looking organ can be hiding something really serious. And check out this study. Researchers looked at patients over 40 who were treated for what was thought to be a simple abscess around their appendix. When they went back in later to remove the appendix, a staggering 29% of them were found to have a hidden tumor. That means what looked like a simple infection was very likely a perforated cancer from the very beginning. So, that brings us right back to where we started. Is the appendix just a useless little relic, or is it something more? A source of enduring medical mystery? An organ that has a surprising immune function, a knack for causing dangerous inflammation, and even the potential to hide a rare and devastating cancer. It seems pretty clear it's a lot more complicated and a lot more interesting than we ever gave it credit for.